Hey everybody, welcome back for another local business spotlight. I'm here with Miss Kelly with Smartypants Medicine. Kelly, tell myself and the audience a little bit about yourself.
Well, thanks for having me.
Yeah.
As you said, I'm Kelly Botta. I'm a physician assistant, and I started a medical practice called Smartypants Medicine about 5 years ago, and been in this community for almost 20 years now, and wanted to provide a more accessible, convenient, enjoyable way to get healthcare.
Wonderful. So can you tell us a little bit about your background and what got you into starting Smartypants Medicine?
Sure. So I have been practicing internal medicine for about 15 years. Started in a small private practice, worked for a big health system. And then after I had my kids and I was in practice for about 10 years, I really started to burn out. I didn't have that terminology then,
Yeah.
but the pace was really intense and we were seeing a ton of people and I was getting home late. And I really thought this wasn't going to be sustainable. And I didn't want to walk away from healthcare because I love treating patients and I love medicine. I love what I do. I'm really passionate about it. And so I was looking for another solution and I learned about this thing called direct primary care, which Winchester didn't have. And it's a low cost monthly membership as a way to get medicine. So similar to concierge medicine, but more affordable. And we didn't have one. So I decided to start one.
Yeah.
Yeah.
So I guess typically, because I've heard that this was an issue before where
Yeah.
doctors, they would have like 15-minute slots for a full day of patients. Like, what is your approach now to that? Because
Yeah.
I'm sure the burnout, I mean, everybody in healthcare gets really, really burnt out.
Yeah, well, you want to do a good job, and that takes time to listen to people and hear their story and have time to think through the complexity of what's going on with people's health.
Definitely.
And so now, instead of having those kind of high pressured visits, we have 30 to 60 minutes with our patients.
That's great.
We see them one at a time, they're not double booked. And we can schedule follow-up visits as often as we need to, which is a big deal because oftentimes in the system today, you can't get back in for 3 or 4 months. There's just so many people to be seen. And so because we keep our practice small, we just don't have that problem.
Yeah, no, that's wonderful. That honestly fixes like a lot of the issues too. And then because I feel like a lot of issues, they get overlooked because you can't diagnose the problem in 15 minutes. Like you can't know their backstory about them, their life habits, whatever it may be.
Right.
It's causing that issue.
Yeah, so primary care gives you that benefit of having a longitudinal relationship with a healthcare professional who knows you and your story and your family history. And so that goes across any type of setting for primary care. It's why it's a big deal to have someone who knows you and can walk into the room and just know by looking at you whether you're well or not.
Yeah.
There's a lot of clinical value to that. And in this model, you're right, we get a little bit more, well, a lot more time, frankly, to just chat with our patients. And we have time to talk about what are they eating? What are they actually eating? How much are they actually moving? What do their stress levels look like? How are they sleeping? All these different things that play into our health. And it's complicated and it takes, consistency and follow-up. So it's been an awesome way to practice and we're loving it. And so are our patients.
Yeah, definitely.
Yeah.
So I guess what's the main reason why you're not working for like a major healthcare system? Is that just for that reason alone, is where you get more time to actually understand the patient and their needs compared to just being double booked and rushing to find a Band-Aid solution in a sense?
I think there's a lot of reasons for it. It's definitely an access issue as a system, like on a high level.
Yeah.
People just really aren't getting the level of care that they need. And so whenever you are the provider who's trying to give that care and you're pressured for time, you get a little bit of moral injury or burnout because you really can't do what you want to do for your patients. And so this model solves that for me as a clinician, that I feel good about the way I'm practicing medicine. I know I'm doing a good job.
Do you feel like you care more since you have more time with the patient instead of just, because I feel like I would run into the issue if I had 15 minutes, like I would, over time, I feel like I would lose that personal touch with
I don't know that it's not that you don't care anymore, but it's the environment that you're in a traditional setting. It sets you up to kind of fail.
Yeah.
We're all doing our best. None of the providers in the healthcare system are bad guys. They're my friends. I've worked with them for years, but the system is just not designed in a way for us to do the best we can. And so we have a lot of training when we go to school, and there's a lot of complexity to what our bodies are doing. We just need the time to be able to figure things out and map the plan to go forward. So this solves that problem. And then, for the mission's bigger than me. I think the mission is also for other providers who are burning out and they're deciding maybe they're going to leave this profession altogether and change careers because they don't want to do it anymore. That's not good for our community either. We need our healthcare providers to stay in medicine. And so I hope in the future that we'll be able to grow our practice and become a solution for other providers, but at the same time meeting that need for the community, that healthcare is affordable and it's here for you when you need it.
Definitely. So
Yeah.
from a patient perspective,
Yeah.
why is the monthly like subscription model better than, let's say, the traditional model?
Sure. So I think it affords itself to just amazing use of technology and convenience that a bigger system just can't do. So we're able to provide concierge level care for our patients, meaning if you text me during the day, I text you back during the same 24 hours, right? And
Yeah.
so that's just really unheard of in our field where there's such a high volume and pressure. You're in phone trees, you're getting, passed around 15 times. If you can just go efficiently to the person who has what you need and get the answer, it's a lot easier for you as a patient. So the convenience is, off the charts. And then also it gives you a way to budget for your healthcare.
Yeah.
So
that
this
is really
is
good.
really cool. People sometimes see the membership as a bad thing, but if you think about it, when you go to the urgent care or when you go and you're paying your copays, you're paying that for that care on top of your insurance premiums usually. And so you're already paying twice for your healthcare.
Yeah.
This is basically giving you a way to budget a monthly amount that you know is going to come out of your checking account, and then you can contact us as many times as you need.
That's a really good
So
idea.
some months, if you're sick, you might use us 4 or 5 times. Some months, if you're not sick, you might not use us at all. But over the course of 12 months, this is something I can afford. It's not going to bankrupt me. I'm not going to get a surprise $750 bill. And so from that standpoint, patients really like that too, because the healthcare industry lacks price transparency.
Yeah.
And
definitely.
I think it's the only industry that exists that way, and I think it's something that needs to change, and so we're trying to bring that change to our community.
Yeah, so you guys are trying to see the change that you've wanted to see over your career.
Yes, and we can't change the whole system, but we can change our piece of the pie in primary care and in our community.
Wonderful.
Yeah.
So let's say in the next, 2 to 3 years, what do you see Smartypants medicine? Like, what are your goals for the next few years?
We're not going anywhere. We just got a location, and so I was house calling it exclusively to start, and then now we grew and we brought on another provider, and so we'll definitely be here in Winchester. I would love to have another location just to be able to bring this to more of a regional. Right now we serve about a 45-minute radius with house calls. And then of course people drive in to get this kind of care, but I would love to see, another couple clinics and a few more providers come on so that we can just expand the service to the community.
Gotcha.
Yeah.
So let's say that someone is like unsure or they just kind of have questions about this style of healthcare.
Yeah.
What would you have to say to somebody like that?
I think that's super natural, and I think you should have questions. It's really different. It's out of the box. I myself thought it was fake. Whenever I first read about it, until I called a bunch of the practices and spoke to the providers, like, okay, this is a real thing. This is a wave that's happening across the United States, and it just hadn't hit Winchester yet. But I would advise patients who are questioning to check out our Google reviews. They'll tell you the story that you need to hear. There's a bunch of them on there, and we don't pay anybody for those, right? These are just clients giving us feedback.
You would be surprised at people who pay for reviews.
Yeah, we're really big about transparency with our pricing and with just who we are as a brand and as individuals. You guys are sharing your lives, we're sharing our lives, and so I would encourage them to check out Google reviews. And then the other thing is we do complimentary 15-minute phone calls with myself and the other providers, so that you can ask your personalized questions. We can make sure it's a good fit for you before you sign up. We don't want anyone signing up for something that's not a good fit for them or for us. So those are helpful.
Are there any patients that wouldn't be a good fit for this type of healthcare?
Oh man, there is maybe one patient group that wouldn't be great, and that is if they have a health insurance plan that's an HMO. It's a little bit technical, but if you have a health insurance plan that's an HMO, they're really restrictive on who you see and what they'll pay for.
Okay.
And so they might be a challenge. It's not that we couldn't see them, but we would definitely want to have a conversation about what that would mean, because the convenience and flexibility might be a little bit altered. Other than that, we can take all comers 16 years old and up. But that might be the only group. Otherwise, any insurance recognizes us. Anything orders we write, meds we write, any of that kind of stuff, they'll honor it just like anywhere else.
Sweet.
So yeah.
Gotcha. So what is a fun fact that your patients might not know about you? Something interesting, something.
Let's see.
Somebody would be like, "Wow, I didn't even think of that. Didn't think Kelly would be that cool to do this."
Geez, I don't know. That's a lot of pressure, Zach. I think people might be surprised to know I'm a bit of an adrenaline junkie.
Yeah.
So I've been skydiving and bungee jumping.
Oh wow.
And so thankfully I did that pre-kids. Now I feel a little bit too responsible, like the risk is too high.
Can't get crazy.
I would be up there skydiving in a minute if I could. So I think people would be surprised by that.
Which one would you like better, skydiving or bungee jumping?
I enjoyed skydiving more.
I got
Yeah,
you.
it was a little bit longer. I felt like I was a gymnast before, and so
Okay.
we flipped out of the plane, and so that was kind of fun to be able to do that.
Yeah,
Yeah.
absolutely.
Yeah, yeah.
And then so the ending question here is, what is your favorite part about your job and what you do?
Yeah. Oh man, could talk a long time about that, but I think to keep it brief, I really like meeting people where they are and helping them solve whatever their healthcare concern is. I think I'm really good at that, and now I have the time to do it. And so I love that kind of ongoing relationship where we can try something, and if it doesn't work, we can come back and tweak it and really work towards getting people to be the best version of themselves from a health standpoint. So I just love the longitudinal care and kind of doing the journey with people.
Wonderful.
Yeah.
So Kelly, thank you for coming.
Thanks
if anybody
for
has any
having me.
healthcare questions or just looking to try something different, free 15-minute complimentary call with Kelly. Kelly, what's a good phone number for them to reach you at?
Yeah, it's on our website, 540-692-6132 or smartypantsmedicine.com.
Sweet, wonderful. Kelly, thank you so much. And we'll see you guys soon.